Medication-assisted treatment is the gold standard of care for those with opioid use disorder. So why is there so much standing in the way of making this kind of care available? I'm Ellen Glover, the Drug Policy, Harm Reduction, and Criminal Justice Campaign Director at People's Action. Today, I'm here to talk about the Mainstreaming Addiction Treatment Act, or the MAT Act, why we need it and what stands in our way. Medication-assisted treatment is the use of medicines such as naltrexone, buprenorphine, or methadone to help treat opioid use disorder. These life-saving medicines reduce withdrawal symptoms and cravings and help prevent relapse. Brendan of New Jersey Organizing Project knows firsthand how crucial medication-assisted treatment can be.
I'm a long-term drug user, specifically of opioids, of 15 years, and I'm 30 years old. Throughout a lifetime of different stages of my drug use, from chaotic use, abstinence and treatment, manageable use, etc., I found that the best option for my health and well-being is MAT, or medication-assisted treatment. To be totally honest, I don't really ever see myself living a life without opioids. I never have, I never will. For me, MAT is a lifesaver because it allows me to deal with cravings that I can't ignore while attempting abstinence. This form of treatment is good for my loved ones as well. If I'm not dealing with the negative effects of my use and not using chaotically, I have more time to be well and be around my family and enjoy a better quality of life with them.
One of the most significant barriers to accessing medication-assisted treatment is the X waiver. The X waiver is an additional training requirement for medical professionals to be able to prescribe buprenorphine. These doctors, nurses, and physician's assistants are also required to get a waiver from the DEA to prescribe and are subject to patient limits. Congressman Paul Tonko of the 20th District of New York is the lead co-sponsor for the MAT Act. Here he tells us why the X waiver is so harmful to those struggling with opioid use disorder.
The ability to prescribe buprenorphine for the treatment of substance use is denied if they do not receive this X waiver. To me, again, it's old school. Why do we allow, for instance, our medical professionals to provide for treatment for pain medication that have experience and credentials and expertise, and not allow them to share their strengths, their talents, their abilities with the broader community that is living with addiction? You know, I'm reminded repeatedly of the fact that 1 in every 5 receives treatment on demand when they have that moment of clarity. That is dreadful, that only 20% of those requiring services, treatment on demand, receive those services.
The X waiver is standing in the way of countless Americans getting the treatment they need. Let's turn to Brenda Siegel of Rights and Democracy Vermont to tell us how the MAT Act could solve this access issue.
The Mainstreaming Addiction Act, or the MAT Act, gets rid of the redundant and outdated requirements that practitioners have to apply for a separate waiver through the Drug Enforcement Administration to prescribe buprenorphine, as well as participate in outdated training and remove patient caps. Again, training that PCPs don't need to prescribe other opioids. This will correct a barrier that almost seems as if it were placed to prevent people from recovering from this disease.
No matter what we look like or where we come from, the overdose crisis reminds us that at our core, we are all human. Our ability to get and stay well depends on everyone having what we need to prevent, treat, and recover from illness. The MAT Act would remove the burdensome, stigma-based barriers so that prescribers could offer this life-saving medication. It treats buprenorphine like any other essential medicine.
This is good legislation, and guess what? We cannot pass it without all of you. So we need you to act right now. Please go to the MAT Action portal and take action as we sit here tonight.
We need to pass the MAT Act, and to do that, we need your help.